You know what? I never ever snore. At least that's what I thought until I was told otherwise. Well, it turns out that most snorers don't actually know how much they snore until it starts disrupting their sleep or someone else's. Snoring happens when the soft, floppy tissues in the back of your mouth and throat get in the way of your breathing. As air is pulled through these tissues, they vibrate, and that's what makes that sound. Now, in most cases, snoring isn't really a big deal, but it can be kind of annoying. So here are some suggestions that might help you turn down your volume. First, if you're overweight, losing just a few pounds can actually reduce the size of the throat tissues, allowing the air to flow more quietly. Second, if you're a smoker, quit. Smoking irritates your throat tissue, and that leads to snoring. Third, sleep on your side instead of your back. This keeps your tongue from relaxing and falling back toward your throat. And fourth, limit or avoid alcohol, especially before bedtime. Alcohol relaxes the muscles in your neck area and your throat, blocking your airflow. Constant, excessively loud snoring can be a symptom of obstructive sleep apnea. This is a serious disorder that, if left untreated, can lead to some really bad health problems. Fortunately, there are some very effective treatments for sleep apnea, but you have to talk to your doctor. Good health depends on good sleep. If snoring is interfering with your sleep, take action now. You and anybody within earshot of you will be glad you did. I'm clinical specialist Michael Dettner. Thanks for watching.